Hello guys, Assalamu alaikum. I'm Dr. Asif Nawaz. I'd like to hear about you all know about my videos, that is MRCS study with me. It's been interesting to and glad to say to you the good news about the recently I have been passed the MRCS Part A from England, so in May 2023. So here today I'm going to discuss about the MRCS Part A preparation that you all seeing here. The most probably I like to say something about the today's presentations, because many of us in the groups, Telegram groups, as well as in the Facebook, they recently told me about the recent changes of the MRCS Part A preparation. So today I'm going to make a short session regarding the guidelines or some changes in the MRCS Part A question bank, along with the patterns that is recently something changes, and so that during the exam hall the whole pattern of the question is a little bit tougher the before. So let's start. So what is the MRCS? First I'd like to introduce about the membership, that is membership of Royal College of Surgeons, which is provided by the 4 Royal Colleges of London, that is England, Edinburgh, Glasgow and Ireland. So these degrees very much prestigious, because by these membership you will be regarded as a surgical diploma or the post-surgical diploma, which is granted in Middle East, UK and USA as a complementary CV enrichment. Along with, you can use it as degree in the Australia and as well as in our country, like in the Bangladesh or Sri Lanka, India, as side degrees with the fellowship like FCPS or MS. So these preparation can be started during 5th year or in the internship, and internship period is regarded as a training experience before the exam. So after the internship you can appear for as a Part A candidate. So this degree is very prestigious, because without it, from the October 2023 you can't appear FRCS exam, that is fellowship exam or the exit exam of the Royal College. So with the MRCS, with a good surgical experience is needed to find a job in the Middle East as a registrar or consultant. In our country, in some corporate hospitals or the non-government organizations, they regard it as post-surgical diploma for you can have the post like registrar or senior medical officer, that is SMO. So why we need these degrees? Because MRCS is established or based upon the UK guidelines, that is NICE guidelines, CRESP sheet and the ATLS protocol. So if you want to know or practice along with the guidelines, you may need these degrees to know the proper way of treatment, proper way of the diagnosis, and proper way of treatment or the appropriate management or initial management, whatever they wanted to ask, you can answer. So and you can use it in your hospital practice. So in our country, with the MRCS, like general surgery, urology, upper GI surgery, collected with a good experience in the corporate hospital like Evercare, United Hospitals, Asghar, etc. So it is in our country. Evercare is not only here, but also this hospital can be found in the Chittagong, Dhaka, and along with the Middle East also. So what are the benefits by doing this? From the July 2022, our Secretary BCPS recognized MRCS, MRCP or COG as a post-surgical diploma, and the student with MRCS completed with 2 years of basic surgical training can join FCPS core training and can be exempted from part 1 and midterm. It is not for the other students, but as I am a Bangladeshi student, so if I wanted to enroll to our fellowship program after finishing the MRCS, we can go through the lateral entry to the fellowship. By this way we can exempt the part 1 and midterm exam, and also he can perform assist surgery in training hospital like a registrar. So as I said that that by doing MRCS one can be suitable or eligible for being a registrar, like almost a senior post, or you are regarded as a senior experienced one. And sometimes in some other organizations you will be regarded as a specialist with a good salary. So for international movements one should go to OET like IELTS. So after the MRCS, if you want to enroll to UK, so you have to pass the occupational English test or the IELTS. So if for doctors, IELTS is a lot more harder than OET. So as OET means occupational, so there are some limitations which is not generalized in the IELTS, but in case of OET is specific for some occupational variation. So I already said that October 2023 MRCS is mandatory for FRCS section 1 exam or the international FRCS, not only international but also the JCIE or Joint Surgical Committee of UK. So after that you have to make a good portfolio or CV with after the OET or MRCS to apply for NHS core surgical training job. Now the mark distribution and the time management. So MRCS part A comprises 300 question, that is MCQ, 180 single best answer for applied basic science ABS for 3 hours, then 120 SBA from principal practice of surgery in 2 hours. In between two exams there is a gap of 1 hour for lunch break, and everything is SBA, so it is not so easy. First of all, I'm going to say that there are many videos or there are many others courses. They usually say that if someone read out in the EMRCS in the explanations and practice and so on, they will pass. No, it's not like that, because day by day all the new questions are coming, because ICBAC, that is International Collegiate Surgical Committee, they asked the MRCS holder, not only MRCS but also the fellows, they are asking about the new questions. So in near future the recalls will be absolute, because no question will be repeated, like 10 to 20% only, and from the recalls as well as FOGIA or for the others or bullet notes. Yes, you can study bullets or Salah bullets also called, and you can also go through Umayma notes, because it is so short about the EMRCS question bank. Yes, but EMRCS is mandatory because the question pattern or the pattern of SBA is something new for some continents of our country, not only our country but also Pakistan or Nepal or India. So you must need EMRCS latest edition or the online edition or the offline latest to practice, because first you need to know that no question will be repeated from the EMRCS directly. I repeat, no question will be repeated from the EMRCS, because a wrong concept. Because I passed the MRCS part A in the second attempt, and in the first attempt from the January 23, I usually used to memorize EMRCS question pattern, their clues and the answers, but I was foolish in the exam, because the most of the questions are a little bit different from what I practiced, but the conception is very important. So you have to make your basic very strong along with your assessment knowledge, your experience. So I will tell you that after internship, just please don't go for the exam too early, because you need some experience, or you need to go for some house job or medical officer or AR, assistant register or register, or the junior house officer, to have some experience, or operative experience, or decision related experience. So it will be given to you by your professors or your fellow colleagues or seniors. Those are in touch with the patient. So it's not, this exam is not for the freshers. Yes, some some students pass after the internship, because that is very rare. In 100 past patient, in 100 past candidate, you can see that 30 student or 50 students are so new, and in between 30 students, 5 to 10 students can be passed first attempt. Okay, because the lack of experience. So as I appeared in the second attempt, so I thought that there is a gap in the basic, or there is a gap in decision making during second part, that is principal practice of surgery. So for that reason, you need to go through some textbooks, because only one textbooks, that is principal practice of surgery, that is James O. Garden. Okay, and for the applied basic science, you need to go for basic science for MRCS Part A RAF 3, that is a 4th edition already being came out, so you have to read out that. So time is very crucial, because one SBA for 1 minute, so you must not lose so much time in one question. So if you think that yes, it is the answer, okay, please give it. If you don't know anything, just make it flagged. Okay, but don't waste time, because you have to finish the exam, or you have to go to up to the 300 questions before your time limit. You have to save questions. So there are some questions so much easy. There are many questions, like 50 questions. It will be so easy, so that among 300, so you have to just click it very fast. Yes, it is answer. Okay, and passed. Okay, so these by doing this, you have to save at least 30 to 40 minutes in first half, 180 SBM, and in the second question, that is 120 SBM, you have to, it is very crucial, because time is so limited to 2 hours only. So only 10 to 15 minutes. If you very fast, up to that 10 to 15 minutes is enough to recheck the flagged questions only. So don't be very quick, that will miss the tricky scenario. On the other hand, don't be so slow that you miss the train in last. Okay, try to finish paper in 30 minutes earlier, and the paper 2 is 10 minutes earlier, because it is generalized for all. Because if you don't complete if you don't complete the whole period, in that case you may miss some question, like 3 to 5 questions or 10 questions, whatever it is. It's very crucial. So part A is conducted by the Pearson View, that is online exam conductor. Not only MRCS but also FRCS section 1 is also occurred by the Pearson View. So here the study strategy and plan. So previously 1 to 2 years earlier, or 2020, in the COVID period, the question was a little bit easier, because many students cannot go to the exam centers, or some online sessions. Online exam system is usually implicated. So it's very crucial for taking exams, or from the different countries, because of the pandemic. So but now from the May 2022, September 2022, January 23, and at least the May 23. So all the patterns and questions are changing. So new recalls, new stems. So you have to go through your basics first. For the newcomers, those are just wanted to try to start the preparations, I will like to say that please read these two books, okay? That is Basic Principle Science or MRCS 4th editions, and the James O. Garden and the Ron W. Parks, okay, Warren Parks. So these two books is listed as a book list in the Royal College of Surgery curriculum. So you must go through the big, very important and very good books. That is nobody will give you the suggestions of reading this book, because I read out these books. I can show you here. I already printed these books for myself, because when I miss the January sessions in just 5 to 6%, and I see this book is very good for basics. That is the second part, not only the second part but also some questions from the applied basic science only. So I will say please print this book and make the reading at least 2 to 3 times, and you will see that now no question will be new to you. Everything you will make a diagnosis, or you will make identify which is the best options or which is the appropriate options for as an answer. Okay, now the basic science for MRCS, it is a very good books. I already go through this book for 3 to 4 times for building basics. So that is the 8th editions, and the RAF 3 4th editions, EMRCS explanation and practice questions. So you will go through EMRCS latest, that is now 2023. You must buy or make a subscription for 2023 to 24, okay? And the recalls, big B's, 10 years, okay? From now on you have to collect 10 years of recalls, because some questions are we may not seen, because a question came to the January 2023 or May. That question is moderately asked about 8 years ago. We don't know, because we don't find out a so lost recalls, but Royal College have all the questions. So their question bank is so old, some things, and some are new, so they will collaborate, or they have some team of question makers. So they will ask something very old questions like 10 to 20% maybe. So you must not forget to collect recalls and practice it. And the house training, because you need a 1 year to 1.5 years training may be needed, because it's a very matured membership, so mature degree, so they want some mature suggestions or a mature advice or approvals. So you have to go for small training, okay? And the other sources, yes, I also completed these resources like 1 to 2 times or 3 times, because I took a lot of time, because I passed in the 2018 and completed my internship in 2019. After that I used to read a lot of question books. Like these are the question books, that is patterns. They are 500 to 250 or 500 SBS, so they are the patterns. In the revision you will not find any question directly from here, but they already made a few questions which is made by the MRCS or FRCS candidates. So you can have some knowledges, or you can go through some explanation, to know the basics. And also I already said the Reda notes, or it is also called the Sala notes, So Sala Notes is very good, I think, for because it is the compilation of MRCS explanations. I hope it is very good book for after the RAF 3, because after RAF 3 you can go for Rida Notes and simultaneously practice MRCS. And also for a basic physiology and embryology, these two terms is very tough. In my exam I faced difficulties in physiology, also the embryology, because in the embryology they asked about the gut rotation, they asked about the time of completion of organogenesis and the organ specific knowledge. So in the MRCS it's not so deep. In that case you will go for BRS embryology, which is the book of book for specially made for USMLE exam, but I think it is the best book that I used for embryology. And before the time of at least the before the time of exam, I used to read that bullet notes, so my bullet notes or the bullet suggestion from the Sala courses, because everything you will you can have your surroundings, like in our country we have a market that is Nilkhet. We used to go there, and we will have the printed books of this PDF. Also there are some people who is ready to have your PDF and make a book formats. So it is very easy, because and so much available for this kind of study books. And I think we all know that MRCS Part A, not only Part A but Part B and FRCS, these all are the exams are so expensive, and so like a junior doctors or in our country doctors, and also the neighbor country doctors, so their economic status, not everybody has the capability to sit MRCS Part A, because it is 578 pound. In our BD currency that is 78,000 taka, but in the India it is also costly. So one should have a better ground that a Part A exam passing score is not so good, because if you spend a lot of money in the Part A, you must think about that if I may not pass in the first attempt, I may have to sit for the second attempt or third attempt. So you must have a better ground. You have to be not rich, but you have to collect some money, or money in the bank, or you may need to take loan, some study loan for completing the MRCS, because these money will come back to you after the finishing the MRCS, and you will have a good post in the hospital with a good salary. So that will not be a problem. So so like me, I have to cover a second attempt, so it is almost 1.5 lakh I have been spent out, so that I have to wait for a long time for gathering my money, like 2 to 3 years I used to study with that, and along with the I usually go to job for and save some money in the bank. And the family issue, though this may be off topic, in some families they will not support MRCS when in our country is still not recognized as a degree. Yes, in our country like Bangladesh or India, MRCS is not supported, and the maximum people will don't know about the MRCS, like the general people. So they used to hear about the FCPS or FRCS or MS, these kind of degrees. So these are the fellowships, so they are recognized, but in our medical curriculum it is not recognized here, but MRCS is recognized all over the country as a prestigious membership. But so as it is not recognized, so there are maximum families, those who are supporting us, like my families, like the doctor's family, they used to say, oh, it's very costly, I think you should not go for that long way, or you should not go for a very costly exam. Better you can start for FCPS or MS, it is very valuable, and it is a fellowship. You may not not to go for a simple membership. So they motivate you for leaving the MRCS and go to FCPS. You must know that FCPS passing score, that is paper 1 part 1 exam, is so low, like 10% only, and in the FRCS it is also slow, like 15 or 20% highest. So before going to fellowship, you may need a membership for starting with good salary and your making your ground strong. And you may also go to the UK and have this surgical post, that is training post for continuing your CCT training in the specialized subject. So they will not understand about this. So I think like me, those economic condition is not so good. I like to suggest you to join Dr. Bishwai Nagy's Master the Class MRCS study group, and avoid the negative people and stay motivated. This is which is helpful and very trustworthy, and it is completely free. You need no money to spend. Just go and daily mock sessions after the study. You can assess yourself that and where I am, so how much I need to study. Okay, and try to make up friends in the Telegram, also your surrounding, who are also preparing for MRCS Part A, which will be helpful for you. And lastly, the keynote message, last but not least, don't lose hope. We need to go a long way, so there will be a lot of sufferings and stressful life, so don't worry, and help is always there. I have a YouTube channel where I used to teach Bailey Labs chapters and MRCS Part A basic ongoing, that I already go through the pathology first part, and it will be completed by the later on. So keep it up, and I'm always active on Telegram, WhatsApp also. So any help needed, I will be there. So that is all about the today's presentations about the recent changes of the Part A preparation. I hope that this session will be helpful for you, because some doctors from all over the country, also in our country, they used to take guidelines from us, from me especially. They used to text me about that, and I already told you that I will make a video about that, and it will be giving you some hints, because I am the victims. I already completed this toughest, most part 1 toughest exam in this continent, that you can, this Asian region, and also. So be motivated, and I will say, please don't go as early as possible, but you need some house training along with some basic knowledge, and go to the textbooks, that is these 2 books, because only somebody will tell you that 3 to 6 months is enough. Yes, 3 to 6 months is enough, because but you can't complete your all the knowledges and have the confidence in 6 months, because you have to make yourself revised like 2 to 3 times these books and also the EMRCS. Just don't memorize EMRCS answers with the questions, because they will not be repeated. Maybe 10 to 20% they will moderate, but they will not be repeated. Okay, so don't memorize the EMRCS things, but go for explanations. Go for explanation of EMRCS on every questions. That will give you some basic, and which will be helpful in the exam. Okay, overall exam period is stressful, that is, it is 5 hours exam, so you have to be very cool, calm, but it's the costly, so economical is not so helpful. So I think if you want to pass in first attempt, you may need some times over it, and discuss with your friends, and you can have the course. Also you can have any courses from like Salah, Dr. Reda, or Salah, or the Turkey, whatever. There are many like study medicals in the India, so there are many kind of courses available in our country, but also the other country like Doctor Academy, like Synapse. So there are many own country courses. You can go through that, because and it is very so much cheap, like 5,000 or 10,000 takas or 15,000 takas highest. And try to see some recorded videos, because the courses who has a recorded videos, you can continue the courses before you pass. And you have to consult with your family that you will pass, and just make them prepared to support you, so that they will not make any negative comments about the degrees. Not only the negative comment, but also they need to encourage you, so that you can read as much as possible in a day. Okay, reading continuously, and try not to memorize the MRCS, and go through the basics, and just try to find out the recalls. Okay, and study. And there are some Fauzier sheets and some others. Just go through it, and have and make the basics strong. Okay, thank you very much for watching this session, and I hope you will stay with me in my latest videos later on. Thank you very much. Peace. So I think you need to understand all the patterns. So I think it's today's finished. Thank you.